I am Dr. Thompson Akwo, the editor of Health and Development magazine. And we are at the Convention Center at the Washington Convention Center, downtown Washington, D.C. We are part of the American Academy of Dermatology annual meeting 2016. And with me is
Dr. Gary Brauner. I'm a practicing dermatologist from New York City.
thank you, sir, for coming to speak with us this afternoon. You just did a presentation on religion and dermatology. So what was the title of your presentation?
My title was Holy Holy, Religion and Dermatology, and it was a survey for the members of the American Academy of Dermatology, trying to explain to them about the concept of cultural competence. Uh, Part of our understanding of our patients when they come in and present their complaints to us. The American population is incredibly diverse. Every country in the world has sent their citizens to become citizens or visitors in the United States, so that when a dermatologist sees a patient, he can see someone from anywhere in the world, even though he or she has not gone everywhere in the world. So we have to be concerned about the attitudes of patients when they come in, because those may affect our ability to communicate properly with them, and also to communicate the way they should be taking their medications or treating their diseases. Dermatologists have to understand, all physicians have to understand that certain cultural things that our patients will abide by will very much affect the way they're able to cooperate with the instructions that we give them.
Thank you very much. You gave the lecture this morning, and you gave a number of dermatological problems which are related to religious activities in different religious cultural settings, from the East to talking about Christianity, Islam, Hinduism. Can you just give me a number of those disease conditions which are related to religious practices as you gave today?
Oh, it's, I'm sure every religion is replete with problems that occur because of certain elements of their practices. I discussed with respect to Judaism, diseases that are reflective of rashes that people can get from use of certain accessories during prayer that are made of leather, to which they can become allergic. I discussed certain problems that we can have as dermatologists with post-operative care because of habits that people have, religious habits they have, customs they have about bathing, so that when Muslims are praying, they have to be very scrupulous about drying after washing, because the process that occurs can allow them, if feet are not, for instance, dried, for the spread of fungus infection in the feet. So again, you don't want to do a procedure where somebody is going to be contaminating their skin and not cleaning it properly. The same kind of thing basically occurs in very religious Jewish patients who have to immerse themselves, particularly women, after they've had their period, as a cleansing act. And when they do that, they can't have anything that is extending out of the skin. So if one is going to be doing a surgical procedure, you can't put a bandage on, or you can't put stitches in unless you know that they're not going to be timing it properly.
Thank you, sir. Many people out there do not know that when the Bible talks about leprosy or the disease, it's not leprosy but a syndrome. You you explained that today. Can you, in a few seconds, allude to that? Why is leprosy, as said in the Bible, is not what people take it to mean today?
Yeah, the leprosy in the Bible is not leprosy. The Bible, the Old Testament of the Bible, in which the word sarat, which people have translated as leprosy, was written between, say, 1000 and 1500 BC. Leprosy did not appear in India until about the year 600 BC. So there was no leprosy when the Bible was written. And leprosy, in fact, didn't really appear in the Middle East till about 330 BC when Alexander the Great returned from India. So there was really no evidence of leprosy at the time the Bible was written.
Thank you very much. There is those who say that religion and spirituality is very helpful vis-a-vis stress and coping in improving health outcomes. What will be your comments and your thoughts on that?
Well, my thoughts are that I think that that probably is true. I didn't discuss that specifically in my lecture, but certainly spirituality in patients will help them to overcome certain aspects of disease, will help to make their disease improvement progress more rapidly.
What is your advice to physicians who may not be integrating what you are teaching today? How would you actually advise them to be involved in most of the recommendations you made vis-a-vis your teachings?
Well, I think regardless of what country a physician is in, I think part of our initial asking the patient about things like allergies that might interfere with their medications should also include asking them whether their religious beliefs might interfere with our ability to cooperate with our instructions. Because based on their religion and their belief, they may not be able to take certain medicines that may, for instance, be placed in a gelatin capsule that is made of pork, because most gelatin capsules are made of pork. And there's several religions, such as Judaism or Islam or Hinduism, where such a capsule that the medication's in would not be acceptable.
Having said that, may I ask you the last question? How did you get into religion and spirituality in dermatology?
Well, I've always been interested in diversity in populations. My initial interest actually was in African skin and black skin. And I was the author of the first chapter of in a textbook, in the dermatology textbook on black skin in 1975, which was the very first one that was ever written. And in being interested in diversity, I became interested in diverse things such as religion as well that might affect patient care.
Thank you very much. I would want to say that lots of people out there do not know who you are and where you are and the practice you're doing. But with this, they may want to contact you and maybe invite you to speak at their meetings and conventions on this very important topic within the context of integrating spirituality in healthcare. So how do they get to you?
Well, they can reach me through my email address if they like.
Which is?
My email address is dermlaser, DERMLASER @AOL.com.
Thank you very much.